So everyone can see. So guys, if you have any questions, you can just say, if you want to say excuse, no, kaya hindi ko makita inyong chat. So if you have questions, you can reserve it later, no, during the break times, or you can just say in your microphone that you have a clarification or a question. Okay. So for this afternoon, we're going to talk about your cardiac and peripheral vascular disease rehabilitation. So first off, we're going to focus more on your cardiac rehabilitation or cardiac physical therapy. So the first, pinaka-importante gid is the intervention for your coronary artery diseases. So the preferred practice pattern for this disease is your pattern C6D, or your impaired aerobic capacity endurance associated with cardiovascular dysfunction or failure. So more on building of the cardiovascular endurance, or the VO2 max, or the maximum oxygen uptake of your patient. Okay, so do dira siya naka-center ang preferred practice patterns for coronary artery diseases. So as we can see here, this is from O'Sullivan. So these are the current patterns or the preferred practice patterns for your cardiovascular and pulmonary diseases. So for pattern A, usually for prevention siya and risk reduction. So let's say, for example, you have a patient nung hindi pa man siya so normal pang iya nga mga so everyone can see blood works, or ang iya nga mga like may kaagi siya ETT and then normal pa siya. So what you do for this patient is prevention, okay, before siya magka-CAD. Next is your impaired aerobic capacity or endurance associated with deconditioning. So more on deconditioning cases, so such as bedridden siya for a long time. Okay, so if you are bedridden for a long time, so ang iyang cardiovascular endurance nag-decrease. Okay, for C is impaired ventilation, respiration, or gas exchange and aerobic capacity endurance is associated with airway clearance dysfunction. So this one more on COPD. Pattern D is impaired aerobic capacity or endurance associated with cardiovascular pump dysfunction or failure. So more on mga CHD. Okay. And then pattern E, your impaired ventilation, respiration, or gas exchange associated with ventilatory pump dysfunction. So more on pulmonary issue that is related to your CHD, CHF gali. For your pattern F naman, impaired ventilation, respiration, or gas exchange associated with respiratory failure. So more on respiratory arrest, ARSD. Pattern G, impaired ventilation, respiration, gas exchange, and aerobic capacity or endurance associated with respiratory failure in the neonate, so more on pediatrics. Pattern H is impaired circulation and anthropometric dimensions associated with lymphatic system disorder. So, ang main focus is this one, okay? Your pattern D. So, this is the one for CAD, no? Okay. So let's talk about the goals. So what are the goals or the expected outcomes that we want to see in a patient, when this patient is referred to us for cardiac rehabilitation? Of course, our primary concern is for the patient to have his aerobic capacity increase, yung iyang cardiovascular endurance. Okay, and next is the ability to perform physical tasks that is related to self-care, home management, community, and work integration or reintegration and leisure activities is increased. So, diba, when people are deconditioned or when they undergo through trauma or surgery, sometimes naga-regress. So, naga-back to zero or naga-decondition ng ilang halawa. So, we need to increase that one. And we can do that by performing physical tasks such as mga everyday tasks or exercises that can increase their endurance, both muscular and cardiovascular. Okay, next is physiological response to increase oxygen demand is improved. So we need to, because your heart and then your lungs, ang cardiovascular and then the pulmonary systems, they are interrelated. So, if si heart may problem, maapektuhan niya man si lungs. Si lungs, if may problem, maapektuhan niya man si heart because they work hand in hand to supply the body with oxygen. So that's why they are really interrelated. So as you can, actually karon later on, sa exercises nga part, you will see no nga most of the exercises for cardiac, though ano man siya, ginaubra man siya for pulmonary patient or pulmonary rehabilitation. Okay? Of course, we also want for the patient to increase his strength, power, and endurance. So, when we say power, amo ni siya ang output, output sa iyang work. Okay? So of course, we need to increase the strength also because if we increase the strength, mas may endurance si patient to perform his task. Of course, symptoms associated with increased oxygen demand are decreased. So malesen ang symptoms niya ginabatsyag ni patient. So hindi na siya pirmi gina-dyspnea or gina-SOB, shortness of breath, doon siya pirmi ginahapo, hindi siya dasig kapuyo, no? So mas dako ng threshold niya when performing activities, hindi siya dali makapoy. I don't know if you have noticed, no, ako na-notice ko gini, when the pandemic started, no nga daw wala na ta activity tanan, wala na ta pirmi ako like work is more, na siya, no, mas concentrated na siya on sitting down 8 to 10 hours a day, looking at my computer. So, na-notice ko no after a few weeks or even a few months, though feeling ko doon nagnubo ako ng cardiovascular endurance. So I'm not that na siya, though pirmi na ko, though gamay-gamay lang activities ginahapo na ko. I don't know if you've also experienced that, but based on my own personal experience, so amo na siya, no. So what more no sa mga patients who have suffered coronary artery diseases nga may blockage na gid mismo sa ilang blood vessels sa heart. So if they have this, so mas more pagid sila, mas prone pagid sila into decreased cardiovascular endurance. Okay? Next is the ability to recognize a recurrence is increased and intervention is sought in a timely manner. So always remember guys, no, your patients who had a myocardial injury. If you still remember at class before about CAD and myocardial injury, di ba we talk na if si patient nakagi na MI, naka-myocardial infarction na siya before, there is a bigger chance na ma-repeat ang injury nga na. Okay? So, do parehas mo na siya sa stroke. So, if si patient kagi na stroke, there is a big chance na ma-restroke siya liwat. Okay? So this time around, after MI, tapos nagpa-rehab siya, of course, part of our treatment plan for the patient is patient education. So it's part of our plan of care for the patient to educate them on what signs to look at, kung ano ang mga symptoms nga he should be wary about, and that when he experiences an angina, again, so dapat alert na siya, no, balaan niya na kung nanuubrahon niya. Okay? Next is risk of recurrence is reduced. Of course, when we do ang rehabilitation, when we perform a plan of care for patient, especially for cardiac rehab, our main goal is that dapat hindi na siya magliwat. Okay? Or i-reduce ta ang risk nga magka-myocardial injury siya liwat. So, if si patient nang hindi namin iya lifestyle previously or medyo heavy set si patient nang overweight siya or dako ang iyang pelvic girdle, ang iyang ang waist circumference niya. So of course it should be part of our plan, no, as a holistic healthcare approach sa physical therapy, is that dapat i-educate na siya on the effects of these lifestyle and the risk factors that comes with it. So, let's say for example, para sa patient, if dako iyang waist circumference, so dapat i-educate na siya nga dapat ma-lose weight siya, And then, ang iyang mga blood works, if medyo mataas, of course, dapat ipabalik ko to sa normal with proper consultation sa iyang PCP or sa iyang primary care physician. Okay? Next outcome or goal that we need is we need to see behaviors that foster healthy habits, wellness, and prevention sa kay patient. So, amo to ka ginahambal ko sa inyo. That is part of our roles as PTs, no, in the holistic care sa aton nga patient, nga dapat hindi lang kita mag-focus sa exercises, also dapat sa well-being, also because ang cardiac rehabilitation is actually a multi-system approach. So hindi lang siya nga, kumbaga kung may sakit si heart, hindi nga sa heart lang na siya ang sakit. Okay? So, if affected si heart, of course, affected ang whole body because si heart ang naga-pump sang blood, no? So, siya ang supply sang dugo sa whole body. So, if may problem si heart, so affected ng tanan. So, that's why dapat holistic ang approach when it comes to cardiac rehabilitation. So, dirigin nagagwa ang pagiging therapist mo. Okay? Next is decision-making is enhanced regarding health of patient and the use of healthcare resources by patient, client, family, and other significant others. Okay? So let's see, no,